Autoimmune diseases can show up in many different places, and that can make people believe that they're actually different. But when you get down to the true initiation of the disease, it comes from chronic inflammation that starts triggering your genes for disease. Autoimmune disease is a disease in which your immune system has actually lost the ability to differentiate between the things it's supposed to attack, like viruses and bacteria and cancer cells and abnormalities that are happening in your body, and it instead starts attacking your own organs. And there's many different types of autoimmune diseases that are basically labeled by the symptoms and the lab tests, but in my world, they're the same. It's your immune system is running rampant, there's a glitch in the system. And so, people have primarily fatigue and joint pain. They're usually rheumatoid arthritis. People with lupus can have many different organs involved. I've helped people reverse lupus in their kidneys, lungs, brain, heart. Then there's other ones that affect the skin. There's different types of skin lupus. There's also things like scleroderma. There's Sjogren's that can affect your salivary glands and the mucus glands in your eyes and other places. And then there's things like multiple sclerosis where it's attacking your nervous system. So autoimmune diseases can show up in many different places, and that can make people believe that they're actually different. But when you get down to the true initiation of the disease, it comes from chronic inflammation that starts triggering your genes for disease. So inflammation in of itself is a normal process. Our bodies are supposed to have inflammation. That's the reaction that takes place when you get an infection. It's an inflammatory reaction. You want that. But people also can get inflammatory reactions from eating foods that we're not meant to eat. So most people are eating inflammatory foods, breakfast, lunch, dinner, snacks all day long, triggering inflammatory responses. You can get inflammation from stress, from trauma, from depression. And so when you've got constant triggering of the inflammatory immune system all day long from all of these different areas, you can actually have the system overload basically, and it'll trigger your genes for disease. And that might be different for each person. For some people that will be autoimmune, and for other people it's going to be diabetes or heart disease or cancer or other illnesses, but that's the pathway by which it happens. So when you're trying to reverse autoimmune disease, you have to look at all those different areas. So I've helped thousands of people at this point from all over the world reverse many different autoimmune diseases, including the ones I just mentioned, as well as things like diabetes, heart disease, high blood pressure, all of these things by looking at not only what they're eating and making sure that they are optimizing their diet. It's something I called hyper-nourishment, where I intentionally overdose them on the nutrition that optimizes cellular repair and the anti-inflammatory immune system, which is usually starving, and also looking at their stress and their sleep and all the other factors in their life, their relationships, everything that's contributing to inflammation. Because if we can help in all of those different areas at the same time, then the nutrition really does its job, and it's amazing how rapidly people can feel better. I mean, I have rapid recovery programs where people work with me for 4 to 6 weeks, and the majority of people who do those programs are already symptom-free in that time period or less, just by really working on all those different areas of their life at the same time. So if any of you are listening who are like, wait a minute, yes, I have autoimmune, I've definitely had trauma, I have high stress, I don't sleep enough, my diet is terrible, all of those things contribute. Now people do ask me about what if it's Epstein-Barr, what if it's CMV, is it a virus, is it mold, is it Lyme? There are many things that can trigger autoimmune, but it's never a light switch. It's always it's the accumulation of inflammation from all these different things over the course of your life, and then there's usually one event that kind of puts you over the edge where you actually fully trigger the disease.